Hi everyone, I wanted to come and make a short video and let everybody know that I got released from the hospital this morning. The brain surgeon's assistant let me come home one day earlier than what's normal to come home early because I quit smoking when I went in for the hospital, so she's very pleased with me and my recovery's doing well, so she let me come home. I'm on very restricted activity. I don't even know if you want to call it activity. I'm basically not allowed to do anything. I have to sleep sitting up, so I'll be sleeping in the recliner, and the packing's out of my nose and everything, but it's still very sensitive, and they did end up having to break it up in the cartilage. It doesn't look so bad, but you really can't see too much. I don't know. This side's okay. There's just one place that's open in there, but this whole side is where they did the surgery, and it is very sore, and I'm not allowed to sneeze. If I sneeze, I have to go to the emergency room because it could cause me to hemorrhage, and I can't taste anything, and I can't smell anything, and I'm taking a lot of steroids, and I have to continue to take them, and my blood is way out of proportion. Things keep happening, like in the hospital, like Stacy said in her video, I was producing way too much urine. They got that resolved, and then I started not producing any potassium, so I had to take a whole bunch of potassium pills, and now they're watching my cortisol level because it's way down, and if you stop producing that, you'll die. So if I start to feel really bad, I have to go straight to the emergency room. Then in 3 months, I have to have another MRI done, and they're going to look to see what's left of the tumor, if there's anything left, because they have no other way to tell. And I see the endocrinologist at the end of June. Yeah, my regular doctor for blood checks and all that stuff frequently, and I go back to see the brain doctor and the ENT doctor in a week. I have to call on Tuesday and make an appointment, but the surgery was a lot better than what I thought it was going to be. I'm not in as much pain as I imagined I was going to be. I was very lucky I didn't get headaches. Sometimes when I stand up, I'll get a really sharp pain in my head right here, and I have to just stop and wait for it to go away. I am getting mouth sores because of taking the high doses of steroids. My tongue is pretty sore. And I'm very tired because I got no sleep in the hospital. Because I stayed on the ICU floor except for the last night that I was there. It was very hectic and very noisy, and I couldn't get comfortable because I had to stay sitting up, and I was taking these steroids, so it was very hard to try to get any sleep at all. And last night they put me in another room off of the ICU, and I have a roommate that had a stroke, and she's basically deaf, and she doesn't have any hearing aids or nothing, and she talks really loud, and you have to scream at her for her to hear you. So of course that made me stay up, because she had different nurses than I did, and they came at different times to do all of her stuff. And everything else, I'm still being treated for diabetes and all that stuff, because it's going to take a lot of time for my blood to straighten out. The doctor said that I'm probably going to go through very severe changes for the next 2 years to get back to different levels. And my dog is glad I'm home, so you're going to hear her. She's playing with her toy. She's going to squeak it loud. But I just wanted to make a video, let everybody see I'm here. I don't look so much different, except for my nose is more a mess. My face is more swelled up. Oh, my eyesight. The cloudiness is completely gone. My left eye is pretty good. I can see with reading glasses from the store on my left eye. My right eye still not so great. I can still only see half the words and stuff, but my double vision is gone, so things are better there. And then wait some time to see what happens with my right eye. Probably going to have to get different prescription glasses at some point. But that's all. And yes, I did stop smoking. I'm not going back. I haven't smoked since I went in for my surgery. I don't have any desire to smoke, because right now I can't taste anything. So there's no desire for it whatsoever. And that's about all. And I wanted to thank everybody who's been in touch with me and checking up on me, and the comments that everybody made on Stacy's videos when she let everybody know what was going on, and Tim and called me up to check on me at the hospital and after I got home today. And Tim is up down mostly, and Stacy, and I talked to Lizzie one time for a minute on the phone, because in ICU you're not allowed to use cell phones. And thank you for the cards from Grammy and Poppy and Beth, Silver Screen Girl, and everybody else's well wishes that you've left around on the internet, emails and everything for me. And I will keep you all up to date. I'm just going to be resting, so take care, and God bless everybody, and thank you so much. And I'll talk to you soon. I love you all. Bye-bye.